Welcome to today's session, and we are looking at management of bleeding and fracture, and this focuses on bleeding, different types of bleeding, to include internal and external bleeding, and to also include the different types of fracture as our topic for the day. What has informed this topic is the statistics that we have that's by WHO and National Transport Safety Authority that demonstrate that the general population lacks the skills to effectively manage bleeding and fractures that occur in an out-of-hospital setting. That in itself cements our today's session, which aims to look at the different types of bleeding, to include internal and external, but the focus for the day is on external bleeding, how to control it, looking at bleeding affecting the face, bleeding affecting the arm, and bleeding affecting the lips, especially the long bone. And this is as a result of fracture. That's why we'll also be talking about management of fracture, which we refer to as open fracture. And this is what we'll be focusing for the day. So allow me to invite our first presenter for the day, with Magdalene, who will be talking about bleeding management or bleeding control of the upper arm. Welcome, Magdalene.
Manage bleeding on the arm.
So first, we will ask the patient to put pressure on the area that is bleeding using their own hands. So we will apply direct pressure on the part that is bleeding. Then we look for clean dressing, which will replace the hand of the patient. So once you replace that particular dressing, you will look for a bandage, which you use to secure that particular dressing at the place that is bleeding. The reason why we are doing this is to ensure that we minimize any more infections in the area that has been injured, but also you want to promote blood clot in that particular area, so that then we can be able to stop the flow of blood as soon as possible before we can be able to transport the patient into facility.
Once you've stopped bleeding, what next?
At that point, we want to transport the patient to the facility. So one of the things you want to do is to elevate the arm on the injured side. So you'll be able to use a sling to be able to do that, as shown in our demonstration. So this is to ensure that there's no blood flow from the other parts of the body to that particular area, and also just to ensure that the patient is in a comfortable position as they move to the hospital facility.
Thank you, Magdalene, for the wonderful presentation. We've really learned a number of skills, and learning is continuous. Every day we learn a new skill. So allow me to invite our next presenter, who is Mr. Nzuki. So welcome to the session, and please take us through the skills that you're presenting today, which is management of bleeding of the face, and especially that affecting the region of the cheek and the front face. Karibu.
So we have a patient who has an injury to the head. Please tell us how we'll stop bleeding to the head.
Thank you. If a patient has a bleeding to the head, the first priority you do is you apply direct pressure on the area of an injury. Once you apply direct pressure, the next thing you'd like to do is you use a bandage that will help in applying more pressure on that wound, and from there this one will help in facilitating blood clot. And once you apply that bandage, make sure it is you are taking it around the head, and that way the patient will be comfortable and you have stopped the bleeding and controlled infection as well. Thank you.
So what if the injury is on the face?
The injury is on the face, and most specific, the injury we get it is from the chin. What you do again, the priority it is applying pressure. The priority is applying pressure. And when you are applying pressure, again you will need a dressing. You apply pressure there, and then you will need a bandage. Then this bandage, again, you will need to put it around the neck, around the head, but you avoid this soft part. You make sure it is on the chin. By doing that, you have primed pressure. Now, as you because you need to secure to maintain that pressure, we say just twist the tips of the bandages, and then you just make a round part, and then you just secure. Once you secure, remember to tuck in to avoid anything from hanging.
So far so good. We are having wonderful sessions, and our last presenter of the day, Dr. Patrick Doyer, will be taking us through the management of fracture of the long bone, and he'll be focusing on the lower limbs. That is what we refer to as the leg. That is what we'll be discussing, the fracture management, and in this case is combining bleeding and as a result of a fracture. So that is what we refer to as an open fracture, and that is what you'll be demonstrating management during this session. Welcome.
So how then do you manage fractures on the lower limb?
Okay. For the lower limb fracture, you priority is you have to identify where the fracture is. Once you know where the fracture is, then the next thing, encourage this person not to move, because any movement is painful at that site of the injury. So after that, you need to get some splints that will help you to immobilize the leg. And in this, we highly advise that the splints should be long enough. So apart from the area of the injury, we also want to immobilize the knee. So the whole leg should not move. So have the splints, 2 splints, have them on the side, 2 sides, and then secure them with the bandages. After you've secured the bandages, and in the bandages that we need to secure, the priority is above the injury first and then below the injury, so that you prevent the area of the fracture not to move, and then again secure below. Or if the injury was below the on the lower leg, then you start at the lower leg and then come to secure the splints above the knees. Then after you're done with that, what you need to do is you want to confirm if this person has sustained any other injury on the other leg. And once you confirm there's no other injury, then what you need to do is you want to bring the legs together. And in this, you can do this by securing it with a figure of 8. And this is done using a bandage. Then secure the legs together, and then from here, then you can make the transportation decision.
So once again, thank you. I believe, team, we have learned a number of skills. We have gained competency in these skills because we've been demonstrated on how to manage a patient who is bleeding. And in addition to that, we've also discussed the different types of bleeding. We've also discussed the different methods that are used to control bleeding, including application of direct pressure, which is, if done effectively, it is very effective. We've also discussed bandaging, which is another method of bleeding control. And in addition to that, we also discussed fracture management, which includes stabilization, the application of splints, the application of different gadgets that can be used to help prevent further injury as a result of fracture. And this then helps to prevent complications. Thank you very much, and hope to see you in our next session. Karibuni sana.